This segment of DelmarvaLife is sponsored by TidalHealth.
8 to 10 million people in the U.S. have it. Some may not even know they have it, and without an early diagnosis, they risk amputation, heart attack, and stroke. We're talking about peripheral artery disease, and the good news is early diagnosis, even prevention, is possible.
And if you do get a diagnosis, treatment is available from the good doctors at TidalHealth. Doctors like Dr. Douglas Wilhite. He is a vascular surgeon at TidalHealth. Thanks for being here this afternoon.
Thank you very much for having me.
So you deal extensively with peripheral artery disease, don't you?
That's correct.
Yeah, so that kind of shows how prevalent it is.
Pretty much what I do for a living, yeah.
Really?
It's just take care of PAD.
So what is PAD?
PAD is a surprisingly common disease. It affects 5% of us by the age of 50 and 20% of us by the age of 70. It is caused by plaque building up in the arteries of the body. So PAD is a generic term that refers to blockage of any of the arteries of the body, be it the carotid artery in the neck or the arteries that feed the arms, or most commonly, where it gets most of us, is the arteries that feed the legs.
Wow. So obviously very serious. How would we know what's going on?
Frequently, it's asymptomatic. It doesn't cause symptoms at all, and that's the most common form of it. When it becomes more severe, the mildest symptom is something called claudication, which is pain when we try to walk. Muscles run out of blood flow, so they run out of oxygen, and they burn and ache when they're exercised. So the average person with mild PAD will tell you that they can walk maybe a block, maybe 2 blocks, and then the calf muscle hurts and they have to stop walking for a minute, let that blood flow catch back up, and then they can go walk again. When things progress past that mild form of claudication, blood flow becomes so limited that it endangers the limb, and that's when you really worry. That's when the danger of amputation begins to develop. And that's why it's so important to try to recognize this disease early.
So what could happen if it is left untreated? You mentioned amputation. What exactly is happening there?
At the point where blood flow is so limited that the tissue can't survive, the skin develops wounds that won't heal or gangrene sets in, that's when amputation becomes an issue. But frequently it's identified well before that in those earlier stages of claudication or more severe pain, and we can do many different things to help restore flow. Those include simple interventions through a catheterization. I can frequently go into the blood vessel with a needle, using an ultrasound and x-ray to see what I'm doing, use balloons to stretch open blocked arteries, or even devices to shave the plaque out of the arteries to reopen them. For patients with more advanced or more severe blockages, there's operations that we do where we can install a new blood vessel into the body to bypass around the blockages and help restore blood flow to where it needs to go.
I'm curious, how did you end up doing this?
I really enjoy helping people get better and enjoy their lives, especially seeing kind of the group of patients that have PAD. It's the more grown-up part of our population. It's really nice to be able to help those people enjoy those later years in life after having worked so hard.
And giving people their lives back. Okay, so March is PAD Awareness Month. What are the key takeaways you would like viewers to have?
So the big thing to think about is at-risk populations. Who gets PAD? Diabetics are at high risk of it, and their doctors are already helping them monitor for this with examination of the pulses and checking feet. Patients who have a history of smoking, if you've smoked more than a pack a day for more than a year of your life, you've got risk of PAD and should talk to your doctor about whether or not you should be screened for it with a simple blood pressure test at the ankle or even an ultrasound test. Prevention is really the key. For people who do have diabetes, managing the diabetes is important. For patients who smoke, it's time to stop. And that's what it comes down to, is you can lose a limb if you continue to smoke. And always think about patients who do have PAD have a really high risk of heart disease. Because if you're able to form plaque in an artery that's big enough to feed your leg, you're able to form plaque in the arteries of your heart. And so all patients with PAD, we do recommend that they also get screened and evaluated for coronary artery disease.
Serious stuff.
It is serious.
And I really didn't know much about it, so I'm glad you came in today, because not something we talk about all the time. You know?
But it's something that can be prevented.
Yeah.
Absolutely.
Dr. Wilhite, thank you so much for coming in, talking about PAD from TidalHealth.
Thank you.